I'm Errol Belly. I'm one of the cardiothoracic surgeons at UF Health Jacksonville. I'm an expert and director of aortic surgery here and care for all the diseases of the aorta and the aortic root. A Ross procedure is a procedure of the aortic root where we actually take the patient's own pulmonary valve and move that into the aortic position. We then take a cadaver or a donor pulmonary valve and replace that in the patient. And why that's different is we're using the patient's own tissue. We're not using artificial, pig or cow valves or mechanical valves, which may require anticoagulation throughout the patient's life. With this one, it's basically your own tissue and all you require is aspirin. Some patients ask, why do we take our own valve and move it to the aortic position? Why not just take the valve from a cadaver and put it in the aortic position? We do have that operation. It's called a homograft implant, and we have followed those patients, but those valves tend to not last as long, and they degenerate over time, which makes taking your own valve and putting it there a much better option. After the Ross procedure, the recovery is very standard to the other aortic valve procedures, usually 5 to 7 days in the hospital. One difference coming to mind is that we do manage a strict blood pressure control after the Ross procedure. And usually we like you to follow up with your cardiologist, who will help us manage that long term. The Ross procedure has made a resurgence here lately in the last 5 to 10 years. We did many Ross procedures in the early 90s and then they were unfavorable, they kind of went away. But there's been a resurgence lately because the data from those patients that we did in the 90s, they're starting to publish and showing that they actually have a longer survival. So there's a select group of patients that tend to be younger patients that show a benefit from that procedure. So we're undertaking it more and more now. It's also very technically demanding, so it needs to be done in kind of an academic health center setting. If you've been referred for aortic valve surgery, usually, if you've had an aortic root aneurysm or an aortic aneurysm, somewhere that we're going to be working on the valve and the root at the same time, usually you're a candidate for the Ross procedure. So I like to tell patients, if you've been referred for aortic valve surgery, it's easy to get a second opinion, just to call UF Health Jacksonville. We do a full evaluation and kind of go through all those procedures and pick that right one for you.